Welcome to BioPractice webinar on the clinical, regulatory, business challenges and rewards of orphan development and approval Europe and international. The presenter for today's webinar is Dr. Horst Dawlat, Vice President Consulting Global Strategy Regulatory Affairs, headquartered out of Germany and branch office in Boston. Dr. Dawlat has extensively made research and worked in developing today's presentation, and we hope you're going to have a very informative session and you're going to enjoy this presentation as well. And in the meantime, if you have any questions during the presentation, we request you to post your questions in the chat box of your GoToMeeting tool, and Dr. Horst Dawlat would address during the Q&A session. And now I would like to hand over to the speaker, Dr. Horst Dawlat. Over to you, sir.
Thank you very much, Raguraj and BioPractice, for arranging this meeting. Dear colleagues in the US, I'm very happy to be with you, and I hope you enjoy some of my reflections in the area of orphan drugs. Of course, it impacts on other fields as well. The subject matter is going to be rather diverse. I'm going to let's move on to the next slide. And and also it's going to be rather detailed, but you're going to have all the slides subsequent to the meeting. So I'm going to just touch on some specific areas in this field, and will point out certain aspects of the development, registration, and then subsequent marketing of these products. What is the track record of orphans, and how do we compare in the States compared with Europe? What about where do orphans originate from? Some are new products, both biologics and small molecular entities, and others are established medicines already, and including biologics. Some may already be approved for non-rare conditions. Others are purely developed for rare. Who are the stakeholders? What are the incentives? What about the safety of orphans? What kind of clinical database do we generate? So I'm going to touch on these themes. On the third slide is an estimate of how many in total rare diseases exist. So as you see, up to 8,000. And they affect, just in the EU itself, rather large numbers, up to 36 million people in Europe. And that is very significant, just under 10% of the EU population. Around 80% of rare diseases have been identified as having genetic origins. So let's just think about, in the US, the Orphan Drug Act and the incentives came into place way back in 1983. This is a long time ago, and in Europe in 2000. The cutoff with regard to what would constitute an orphan is different in the States compared to Europe, and also the definition. So I'll just come back to that in a minute. So we have a legal and regulatory framework on slide 4 that is not the same in the US and Europe, because in the US orphans cover all rare diseases. In Europe it's only those that are life-threatening or debilitating. The numbers are different also. It's between around 5 in 10,000 in the States, 7.5 in 10,000, and 5 in 10,000 in Europe. So in terms of what we call prevalence. Now the thing is that this whole field was strongly encouraged by American Congress and then the FDA going back 2 decades. And then the Europeans came into play rather later.